Hey guys, okay, we're going to start on chapter 11, page 375. This is a super huge chapter. So I am only going to go over the things that need to be highlighted. Again, as always, you're responsible for reading the whole entire chapter. If you have any questions or anything like that, don't hesitate, reach out to me. If we were in class, this would be something, it would probably take us a couple of days to get through. So again, I'm just going to highlight on the things that you need to highlight in this chapter. So we'll be hitting this pretty quick, but make sure that you read it all. All right, starting on page 377, highlight the introduction to the administration of a medication. Pharmacology is a study of drugs and includes the preparation, use, and action of drugs in the body. That needs to be highlighted. For the administering, prescribing, and dispensing medication, please highlight where it says the medication that is administered is actually given to the patient at the office. Medication is prescribed when a physician provides the patient with a handwritten or computer-generated prescription for a drug to be filled at the pharmacy. For the dispensed, medication is given to the patient at the office and is to be taken at home. For example, the physician gives a patient drug samples to take home. That needs to be highlighted. For the routes of administration, please highlight that the common routes of administration of medications are oral, sublingual, inhalation, buccal, rectal, vaginal, topical, intradermal, subcutaneous, intramuscular, and intravenous. The route of administration depends on the type of drug being given, the dosage form, the intended action, and the rapidity of the response desired. That needs to be highlighted. For the parenteral, refers to the site outside the gastrointestinal tract. This term is most commonly used to refer to the administration of a medication by injection. Drug references. Please highlight that where it says it is essential to know the indications, adverse reaction, routes of administration, dosage, and storage. Also, please highlight where it says the physician's desk reference, also known as the PDR, is frequently used in the medical office. The PDR contains information on most major prescription pharmaceutical products available in the United States. The drug administration of the PDR consists of the actual drug package insert. On page 378, for the U.S. Food and Drug Administration, FDA, is a federal agency in the Department of Health and Human Services. The FDA is responsible for determining whether new food products, drugs, vaccine, medical devices, cosmetics, and other products are safe before they are released for human use. On figure 11.11, this is the guidelines for using the physician's desk reference. Please review that. If we go on over to page 380 under drug nomenclature, please highlight number 1, 2, 3, and 4. Under liquid preparations, please highlight for the liniment, lotion, solution, spirit, spray, suspension, aerosol, syrup, tincture. For solid preparation, please highlight tablet, chewable tablet, sublingual tablet, enteric coated tablet, capsule, sustained release capsule, caplet, lozenge, cream, ointment, suppository, and transdermal patch. Also become familiar with table 11.11 on page 382 and 383. And please highlight under the analgesics or the opiates for the drug category and the primary use and major effects for the analgesics, and then as well on page 383 for the antacids. If we go on to page 387 under the antihistamines, please highlight the drug category and the primary use for the antihistamines, as well as on 388 for the the antihypertensives, the primary use and major therapeutic effects, and as for the anti-infectives, on page 391 for the antitussives, as well as the primary use. 392 for the bone resorption inhibitors. On page 393 for the cardiac glycosides, contraceptives, and corticosteroids. On 394, the diuretics, the Expectorants. I didn't say that right for some reason. I cannot say it for the life of me right now. On 395, laxatives. 396, lipid lowering agents. And 397 for the sedatives and hypnotics. And then we're going to go on over to page 398. Please highlight for the system and measurement of medication. Please highlight where it says the metric system is the most common system used to measure medication because it provides a more exact measurement and is easier to use. If we go on over to page 399 on the metric notation guidelines, please highlight the weight and volume. And then on the first paragraph, the last sentence, because a cubic centimeter cc is the amount of space occupied by a 1 millimeter, these two units can be used interchangeably. So for example, 1 milliliter is also the same as a 1 cc. For the household systems, really, actually, the only thing I want you guys to do is go on over to page 400. On table 11.3, for 1 teaspoon and 1 tablespoon, please highlight the household and the metric. For the controlled drugs, please highlight where it says every time a prescription for a controlled drug is written, the physician must put his or her DEA number and the appropriate space on the prescription blank. Please highlight on page 401, Schedule 1, 2, and 3. The classification, please know the description and prescription regulations and the examples. On page 402 for Schedule 5. And then table 11.5 and 403, please become very familiar with that table. And then if we go on over to page 404, please become familiar with where it says date, physician's name, address, telephone number, and fax number, patient's name and address, patient's date of birth and age. On the other side of page 404, where it says the inscription states the most common drug and dose, for example, amoxicillin 250 milligrams, that needs to be highlighted. And the signature, or the abbreviated SIG, comes from the Latin term signa, which means write or label. The signature indicates the information to be included on the medication label. If we go on over to page 405, the DEA number, that needs to be highlighted. And then for the generic prescribing, the very last sentence, if the physician wants the prescription to be filled with a specific brand of drug, instructions must be indicated on the prescription form, such as dispense as written, DAW, or words of similar meaning. That needs to be highlighted. On the other side on page 405, for the electronic medical record prescription program, the EMR software includes prescription program, which generally reduces the amount of time needed to prescribe or refill medications. That needs to be highlighted. If you go down a couple of sentences, you also need to highlight where it says the program can also transmit the prescription electronically to the patient's pharmacy. That needs to be highlighted. If we go on over to page 408, under the medication record, please highlight, it looks like it's going to be the second sentence where it says both prescription medications and over-the-counter OTC medications, including vitamin supplements and herbal products, must be recorded in the medication record. If you go on over to page 409 for the factors affecting drug action, you need to be familiar on page 410 for the age, route of administration, time of administration, and tolerance. You also need to become familiar with the adverse reactions and the allergic drug reactions, such as an anaphylactic reaction. Make sure that you're also aware that an anaphylactic reaction is the least common but the most serious type of allergic reaction. Symptoms begin with sneezing, urticaria or hives, itching, arrhythmia, angioedema, and disorientation. If we are over on page 411, above it looks like it's going to be the third sentence where it says, in general, treatment consists of one or more injections of epinephrine depending on the severity of the reaction. That needs to be highlighted. If we go on down to page 411 for the guidelines for preparation and administering medications, please highlight number 4, 6, 8, and 9 and become familiar with that, and as well as oral administration. Highlight that oral administration means that the drug is given by mouth in either a solid form or a liquid form. The parental administration, highlight where it says medications given subcutaneously, intramuscularly, or intravenously are absorbed more rapidly and completely than medication given orally. On page 413 needs to be highlighted. On the other side on page 413, please highlight that it says when documented the administration of medication in the patient's medical record, the medical assistant must include the site of the injection. For example, right upper arm, left dorsogluteal. This assists in proper site rotation for the patients who receive repeated injection. In addition, the information provides a reference point should a problem arise from the injection site. On page 414, the parts of a needle and syringe. Please highlight under the needle that a needle consists of several parts. The hub of the needle fits onto the top of the syringe. The shaft is inserted onto the body tissue. The opening in the shaft of the needle, known as a lumen, is continuous with the needle hub. Medication flows from the syringe through the lumen of the needle. The point of the needle is located at the end of the needle shaft. The point is sharp so that it can penetrate body tissue easily. The top of the needle is slanted and is called a bevel. That needs to be highlighted. If we go on down to where it says each needle has a certain gauge, needle gauges for administering medications range from 18 to 27 gauge. That needs to be highlighted. On the other side of page 414, please highlight that as the size of the gauge increases, the diameter of the lumen decreases. So, for example, if you look in figure 11.7, it kind of tells you a little bit more on what that's talking about. For the syringe, on the second paragraph, please highlight that parts of the syringe are the barrel, flange, and the plunger. The barrel of the syringe holds the medication and contains calibrated markings to measure the proper amount of medication. A couple of sentences down, please highlight that at the end of the barrel is a rim known as a flange, which helps in injecting the medication. And then the plunger is a removable cylinder that slides back and forth in the barrel. Figure 11.6 also kind of talks about that. If we go on over to page 415 for the safety engineered syringes, the second paragraph, please highlight that safer medical devices include safety engineered syringes. Safety engineered syringes incorporate built-in safety features to reduce the risk of a needle stick injury. Please be familiar with figure 11.9 on page 415 on A, B, and C. On 416, under the vials, please highlight where it says a vial is a closed glass or plastic container with a rubber stopper. A soft metal or plastic cap protects the rubber stopper and must be removed the first time the medication is used. An injectable medication may be available in a single dose vial or a multiple dose vial. That needs to be highlighted. On the other side on page 416, please highlight the following. To remove medication from a vial, an amount of air exactly equal to the amount of liquid to be removed is injected into the vial. The air should be inserted above the fluid level to avoid creating bubbles in the medication. If air is not injected first, the partial vacuum is created and it is difficult to remove the medication. During the withdrawal of medication, the needle opening should be inserted below the fluid level to prevent the entrance of air bubbles. If we're going over to page 418, please become familiar with figure 11.11. And then on the other side on page 418, under figure 11.14, please highlight where it says air should never be injected into the ampule because it could cause force out some of the medication. That needs to be highlighted. On page 419 for the subcutaneous injections, please highlight that a subcutaneous injection is made into the subcutaneous tissue, which consists of adipose fat tissue and is located just under the skin. A couple of sentences down, please highlight that these sites include the upper lateral part of the arm and the anterior thigh, the upper back, and the abdomen. On the other side on page 419, please highlight where it says a needle length varies from 1/2 to 5/8 inch. The very next paragraph, please highlight where it says the amount of medication injected through the subcutaneous route should not exceed 1 ml. The very next paragraph, please highlight that medications commonly administered through the subcutaneous route include epinephrine, insulin, and allergy injections. For the intramuscular injections, please highlight that intramuscular injections are made into the muscular layer of the body which lies below the skin in the subcutaneous layers. On page 420, please highlight the very last paragraph above intramuscular injection sites. Please highlight where it says varies in length from 1 to 3 inches. A 1.5 inch needle is typically used for an average size adult, whereas a 1 inch needle is often used for a thin adult or child, and a needle of 2 to 3 inches may be needed for an obese adult. The gauge of the needle ranges from 18 gauge to 23 gauge. Now we're going to go on down to the dorsogluteal site. Highlight where it says the gluteal muscles are well developed and can absorb a large amount of medication. Also highlight a couple of sentences below that. The medication is injected into the upper outer quadrant of the gluteal area. The site is located by palpating the greater trochanter and the posterior superior iliac spine. That needs to be highlighted. For the deltoid spine, the only thing I want you to highlight is where it says no more than 1 ml. And then on the other side on page 420, highlight where it says this site also may be located by placing 4 fingers horizontally across the deltoid muscle with the top little finger across the acromion process. The injection site is located 2 to 3 finger widths below the acromion process. For the vastus lateralis site, I just want you to highlight where it says the site is particularly desirable for infants and younger children than 3 years. For the Z-track method, highlight where it says medications that are irritating to subcutaneous and skin tissue or that discolor the skin tissue may be given intramuscular using the Z-track method. One medication that is administered by this method is iron dextrin or imifron. The dorsogluteal, ventrogluteal, and vastus lateralis sites all can be used as areas to administer the Z-track injection. That needs to be highlighted. On page 421 for the intradermal injection, I just need you to highlight where it says an intradermal injection is given into the dermal layer of the skin at an angle almost parallel to the skin. And then highlight in the next paragraph where it says the needle is short, usually 3/8 to 5/8 inch long, and the lumen has a small diameter, usually a 25 to 27 gauge. A tuberculin syringe is often used for administering the injection. On page 422, please highlight figure 11.19, and in the very next paragraph across from that, please highlight that the most frequent use of intradermal injection is to administer a skin test, such as an allergy test or a tuberculin test. The medication for the appropriate test is placed into the skin layers, and a small raised area known as a wheal is produced at the injection site. If we go on over to page 430 on procedure 11.5, please highlight number 5, 6, 7, and 8. And then on number 10 for the principal, please highlight that. If we go on over to page 433 for the tuberculosis, highlight TB is an bacterial disease that can occur in almost any part of the body, but usually attacks the lungs. If we go down to the very next paragraph, please highlight that symptoms of active pulmonary tuberculosis includes chronic cough lasting 3 weeks or longer that produces a mucopurulent sputum, occasional hemotesis, coughing up blood, or chest pain. Systemic symptoms include fatigue, loss of appetite, weakness, unexplained weight loss, chills, low grade fever, and sweating at night. Also highlight that most people 90% infected with the TB bacterium do not develop the active disease. If we go on over to page 433 on the other side, please highlight during this time the individual experiences no symptoms and cannot spread the disease to others. Individuals are said to have a latent tuberculosis infection, the LTB1. The only sign indicating they have been infected with tuberculosis is a positive reaction to a TB test. If we go on over to page 434, the tuberculin skin test reaction, highlight that the substance is used in the TST is tuberculin, which consists of a purified protein derivative, PPD. Also highlight that the Manto tuberculin test is the most common method used for tuberculin skin testing. On page 436, please highlight the second sentence where it says the Manto TST is administered through an intradermal injection. And then, please highlight number 1 under the guidelines for administering a Manto tuberculin skin test. And then highlight number 4. And then highlight number 1, 2, and 4 for reading the Manto tuberculin skin test results. And then if we go on over to page 437 in the second paragraph, please highlight where it says that the TST result is negative. A second test is performed 1 to 3 weeks after the first test. If the second TST result is negative, then the patient is classified as non-infected. If we go on down to the tuberculosis blood test, the quantiferon TB Gold QFTG is tested as a new blood test used to identify individuals who are infected with the M. tuberculosis, the causative agent of tuberculosis. Please highlight that. A lot of physicians will prescribe this if they're starting on any type of immunosuppressant agents, or if there's any type of concern that the patient may be exposed to tuberculosis, then they would do it through the lab work, and that's the test that they would order. And I will say that not all lab draws have this test, so it's always good that when you know the prescriber is adding or ordering this test and the patient has to go into an outside lab, make sure that you are sending them to the facility that is able to do this type of lab test. So sometimes you have to call ahead and make sure. Okay, on page 440 for the allergy testing, please highlight that an allergy is an abnormal hypersensitive of the immune system of the body to substances that are ordinarily harmless. Also highlight that some common allergies are plant pollens, mold, house dust, animal dander, latex, dyes, soaps, detergent, cosmetics, certain foods and medications, and venom from insect stings. That needs to be highlighted. For the types of allergy testing, please highlight number 1 under the direct skin testing. And then we're going to go on over to page 444 for the patch testing. Please highlight that patch testing is primarily used to identify allergens that cause contact dermatitis. This is a very common test to do in dermatology offices. For the next paragraph, please highlight where it says a positive reaction caused a small area of contact dermatitis characterized by itching, erythema, induration, and vesiculation. If we go on over to page 445, please highlight in the second paragraph where it says the maximum reaction is usually seen within 15 to 20 minutes. Please become familiar with 11.7 and highlight under number 6 procedural step, as well as number 9. And then we're going to go on over to page 449 under the intravenous therapy, or the IV therapy, is the administration of liquid agent directly into the patient's veins. Also highlight that the veins are most commonly used for IV therapy are the peripheral veins in the arms and the hand. Highlight that when fluids, medication, or nutrients are administered by the IV route, the technique is called an infusion. When whole blood or blood products are administered by the IV route, the procedure is called a transfusion. On the other side, on page 449, please highlight that IV therapy is also administered in outpatient ambulatory settings such as medical office and clinics, urgent care centers, ambulatory infusion clinics, and the patient's home. If we go on over to page 450, please highlight right above where it says earlier hospital discharge, and it says outpatient IV therapy is more convenient for the patient and reduces medical cost through earlier discharge from the hospital or avoidance of the hospitalizations altogether. For page 451, please highlight when scheduling the intravenous therapy. Highlight where it says the medical assistant may be responsible for scheduling the necessary services and providing the patient with IV therapy instructions, such as the length of time required for the therapy, any dietary restrictions, whether to wear loose-fitting, comfortable clothing, and whether someone needs to transport the patient to and from the appointment. That needs to be highlighted. All right, guys, and that includes chapter 11. Again, it's a lot. That chapter's big as well, and so I only hit on the most important parts. But as always, just read the chapter completely. It's important to look at the figures and the what would you do boxes, things like that. That's really important to do. But if you have any questions, don't hesitate to reach out.